Hello, hi. My name is Subramanian Gonupalli. People call me Subuji. I've been in the pharma industry for last 20 plus years, and I've learned a lot because I worked for global MNCs and top Indian companies. So these 20 years of plus years, I've learned a lot of things. No, half of my life I have spent more than half of my life I have spent in understanding drugs and then understanding diseases, disorders, a kind of thing. Today I'm going to talk one important topic. As you all are aware, India has become a diabetes capital of the world, right? So many people have spoken about diabetes, but I'm not going to talk about diabetes today. I'm going to talk one important aspect in diabetic patients. So my sincere request, please subscribe the channel first and watch the video till the end. And I'm sure that your knowledge level is going to be definitely high when it comes to the diabetic patients and suffering with erectile dysfunction. Very important topic, right? Erectile dysfunction in diabetic population. This is going to be the topic. So I'm sure most of the people who are suffering with diabetes are going to have erectile dysfunction. I'll share why I'm talking about erectile dysfunction only in diabetic population, what is the link between erectile dysfunction and diabetic patients, and what are all the pharmacological treatment options available today. Why I'm going to talk about this topic? Because in India, we are always a little conservative in our thinking process, not like Western countries. Western countries, people are very open to talk about any topic, particularly when it comes to the sex. We are very shy and we don't like to share the things with our friends also, with family members, or else we definitely feel so shy to discuss with the doctors also. And I'm going to talk about an important topic, that is erectile dysfunction among diabetic population. See, when people get the diabetes, that itself is a big issue for the people. When person comes to know that he has become a diabetic, there's a lot of depression he goes through, and he will become, my entire life is going to be so difficult to manage. How I can able to manage, and then the person will think about the diabetic associated complications, and he will be in a kind of a fear mode. And then one thing which is going to completely change and ruin the life of the person is erectile dysfunction. So now I will share few prevalences, like few years back, when we try to understand, across the globe around 150 million people are suffering with erectile dysfunction. This is in general population I'm talking about. And by 2025, the estimation is going to be somewhere around 322 million people are going to suffer with erectile dysfunction. This is in general I'm talking about. When it comes to the diabetes, almost more than 60% of diabetic people are already suffering with erectile dysfunction. Can you imagine? India being the diabetes capital of the world, India being 140 crores people, and in diabetes, more than 60% of the people are silently suffering with erectile dysfunction. And then now 40 plus people, most of the times they are becoming diabetic. Imagine between 40 to 50 years of life is very, very important life, even for the professional life, even for the personal life. And most of the times nowadays, people are ending up with extramarital affairs. One of the reason is an erectile dysfunction. One of the reason, unsatisfied relation with the partner. And in that, one of the reason is erectile dysfunction. Why erectile dysfunction is more prevalent in diabetics? I'll tell you. Diabetic means people will have high sugar level. An uncontrolled sugar level is the major culprit. So what happens in this kind of patients? These uncontrolled sugar levels, first they are going to damage the nerves. Nerves. You know very well, when it comes to the sexual life, nerves are very, very important. Imagine you are looked at your wife and you feel, to have some intimacy, and these feelings are getting transferred to your mind through your nerves, neurons and nerves. And again, your mind is going to tell you to have an erection and have a sexual intercourse. This message is also coming from your mind to your, male organ through the nerves. So in sugar patients, when these nerves are getting damaged, where these feelings are coming and going, completely disturbed, that could be one of the reasons why diabetic people are suffering with erectile dysfunction. And the second reason, for the male organ, for the penis to have erection, the major thing is a blood supply. And this blood supply happens through blood vessels. When you have uncontrolled sugar levels, the sugar is going to damage these blood vessels. When it is going to damage the blood vessels, obviously this blood circulation is getting hampered. When this blood circulation is getting hampered, your male organ erection will not happen sufficiently. And by the way, for you to understand what is erectile dysfunction, you will not have a sufficient erection and for the required time to have a satisfied intercourse with your partner. That is where you say that it is an erectile dysfunction. And now, second thing, if the diabetic person is having hypertension, having obesity, having hypercholesterolemia, that means more cholesterol, and that is also going to be one of the independent risk factor for the erectile dysfunction. Now I'll tell you why I'm talking about this. If anybody has become diabetic or else anybody having erectile dysfunction, then now I'm sharing this information and you are going to have more knowledge so that you can take the right decision at the early stage so that you can meet the doctor and you can get the right treatment and you can prevent the erectile dysfunction when you are in diabetes. Erectile dysfunction is generally age related. If the person is having 55 years plus, definitely most of the times they will have erectile dysfunction in general. But when it comes to the diabetic people, if you are a diabetic, you will get erectile dysfunction 10 or 15 years earlier than the non-diabetic person. And or else, imagine you are 30 plus years or maybe 35 years of age, you are suffering with erectile dysfunction and you have to think about this particular issue. When you have erectile dysfunction at 30 plus years, that means probably you already became a diabetic. So your erectile dysfunction issue give a signal to you that you already became a diabetic. And second thing, if you are identifying, if you recognized your erectile dysfunction much early, and if you reach to doctor and talk to doctor very openly about your erectile dysfunction, and you will get the treatment so early and you can prevent your erectile dysfunction, being a diabetic also, so that you can have a happy family life, right? Now, what are all the treatment options are available? The most prevalent and most used drugs are PDE5 inhibitors, phosphodiesterase 5 inhibitors. And I'll tell you a few drugs in that. One is sildenafil citrate, and second is tadalafil, third is avanafil, fourth is vardenafil. These are the four classes of drugs which are extensively getting used to treat the erectile dysfunction. Now I'm going to talk about each molecule. When it comes to sildenafil citrate, it is a very good drug for occasional intercourse. For example, it will take 30 minutes to 1 hour to get erection and it's going to work for 4 to 6 hours time. So if you want to have an occasional intercourse, you are suffering with erectile dysfunction, the better option is sildenafil citrate. And then you know very popular brand that is Viagra, right? And second thing is tadalafil. And this is a very, very important drug, particularly for weekend. For example, this tadalafil work for, it will also take 30 minutes to 1 hour time to get erection, but the effect is going to be there for 36 hours. So that means there is a nickname to this pill, that is weekend pill. So you wanted to have, a regular fun for a full day, with a regular interval, then it is better to take tadalafil. So weekend times when you are going out with your partner, and you wanted to have a repeated intimacy with your partner, then the best thing is to have the tadalafil, right? And the third thing is that avanafil. Avanafil starts acting within 15 minutes to 30 minutes. It's a very fast acting. And then it's going to work for only few hours, again 4 to 6 hours. So for you to have immediate intercourse within 15 minutes to 30 minutes, then the avanafil is the best drug. Another one is avanafil. First I talk of sildenafil citrate, tadalafil, avanafil, vardenafil. Vardenafil is one thing that is again going to work for 4 to 5 hours. Even it will take 30 minutes to 1 hour time to get erection. But in some people will respond to other three drugs, some people may not respond. And in that kind of situation, vardenafil will become one more optional drug. I'm talking about all these things just to increase your awareness and this is for only educational purpose. Please don't take decision on your own. Being a diabetic, you cannot take your own decision and start buying these and having it. Why I'm talking about this? Because this is going to enhance your knowledge. It's going to make you aware what are all the consequences you're going to have being a diabetic with erectile dysfunction, so that you will take the right decision and meet the doctor and take the treatment at the early stage. And one more thing I would like to tell you, with these PDE5 inhibitors, all these sildenafil, tadalafil, avanafil, and vardenafil, there are other benefits also, particularly in diabetic population. For example, in diabetic people, these all drugs are having antioxidant property. In general, in our human body, there are a lot of toxins, get generate in the whole day. And these drugs, being an antioxidant drugs, they're going to reduce these free radicals. That's going to helpful for your body. And another thing, there is a process called apoptosis, a programmed cell death. Cells are going to die on its own. And when you are using these drugs, they're going to save these cells. And another thing, one more major thing, if you see what is the problem in diabetes, the problem is insulin is not functioning the way it is supposed to be. When you take these drugs, it is going to improve the insulin function, so that your sugar levels are going to get controlled. I'm talking about these benefits apart from the erection. These drugs are going to treat the erectile dysfunction. Apart from that, these are the other benefits. And another thing, if you talk about, general in diabetic people, albuminuria means there is a protein in your blood that's going to be excreted through your urine. When it's going to happen? When your kidney is in a trouble. When you use these drugs, they're going to reduce the secretion, they're going to reduce the excretion of protein through your urine, so that the load on kidney is going to come down. Another thing, in general, in diabetic population, the nerves are going to get damaged, and the major microvascular complication that's going to have is diabetic neuropathy. In diabetic neuropathy, the major problem is that the blood circulation has got obstructed. The blood circulation is not happening as it is supposed to be. While taking these drugs, it is going to enhance the blood circulation. So obviously, your neuropathy symptoms are also going to come down. So friends, now I explained why diabetic people are getting more erectile dysfunction. When you get erectile dysfunction, what is going to happen to your family life? What are all the other consequences you are having? And what are all the treatment options available in form of the pharmacological treatment, like drugs? In my next video, I'm going to talk about how you can treat your erectile dysfunction being a diabetic in the natural ways. Now, I spoke about the drugs. So hope friends, this information is going to add some knowledge to you. So even if you are having diabetes and erectile dysfunction, you can reach to doctor, talk very open about it and get the treatment so early, so that you can prevent or you can treat the erectile dysfunction being a diabetic, and you can have a fantastic family life. And if anybody having in your family diabetes with erectile dysfunction, you can talk about it so openly, so that you can help them to reach the doctor so early, they will also get the treatment. Or else among your friends or in your neighbors, anybody is having diabetes, you can talk about erectile dysfunction. My point is that whoever is diabetic, please start talking to them about erectile dysfunction. If they say that they are having erectile dysfunction, please suggest them to reach the doctor. So I shared this information for educational purpose, for awareness purpose. I'm going to make more and more videos on health related topics, because I have a huge experience for 20 plus years, and I'm a life science graduate, and I work with the top MNCs and Indian companies. I'm sure that you can rely on my information, and the entire information, whatever I'm sharing now, whatever I'm going to share in future also, only for the awareness purpose, only for the education purpose. One of the reasons why we are suffering with a lot of other issues, because in India we are so conservative, we don't like to talk so openly about sexual problems. That is where we'll keep suffering within ourselves, and we take the help, we don't take the help at the required time, and finally we end up with a lot of issues. So thank you very much, my dear friends. Keep watching my videos, and if you like my entire information, subscribe it, like it, share with your other friends. Thank you very much.